Hi, this is Fix My Fibro and my name's Bernadette. Today I want to talk about when your hips and pelvic area ache so badly that you can barely stand, it hurts to walk, and it's just agonizing pain within your abdominal pelvic region. And what's really going on there is inflammation of your arteries. And we often get told we have the symptoms of polymyalgia rheumatica, but because we're not over 70, we never get a diagnosis of it because there is no blood test to diagnose inflammation of the arteries. And this aching hips is because it's inflammation around the gut and around all the large arteries of the abdomen. You get pins and needles, aching, you often lose feeling down into your legs. And it's a really scary symptom, and it's awful that we're not recognised for it. Some patients will have their doctors put them on a short course of corticosteroids, and that's like a Band-Aid that kind of helps quell the symptoms so you can walk around again. It's almost like a miracle when you have the drug because within 2-3 days, you absolutely just don't have pain and can function again. But those drugs have quite severe or quite strong side effects. And, using them long term causes other problems. So it is really important to understand that you are actually having symptoms of polymyalgia rheumatica. I've spoken in other videos about my family history. My father had these kind of pains because I got it through my paternal line, even though fibromyalgia predominantly affects females, 90% of females. I got it through my dad, but his mother, my grandmother, also had it. And they've all had these symptoms, but never got a diagnosis until they were over 70 because currently Western medicine believes you can only get inflammation of the arteries if you're over 70. And that is one of the biggest issues with fibromyalgia and this ongoing symptom of inflammation of the arteries. I guess the only other thing I want to say is I did find that Chinese medicine, I had a Chinese medical practitioner who said to me, he's actually the only doctor that truly diagnosed it, said, "Hey, you've got inflammation of your blood vessels." And I said, "Yes, that's exactly what I've got, but no doctor will diagnose me." He actually said, "Don't worry, I can fix it." And sure enough, the Chinese herbal treatment he put me on, within 2 weeks, all gone. No need for corticosteroids. It was amazing. So there are alternative treatments that may work for this inflammation of the arteries, and the primary cause to it is this mast cell activation that releases all these cytokines, interleukins, prostaglandins, all these immune mediators that cause inflammation. And it is real. You know it. It's agonizing. It's totally debilitating. We're not diagnosed for it. We're not treated for it appropriately. And that's why it keeps happening.